Burr procedure. A burr hole is a small hole drilled into a skull. Burr holes are used when the brain surgery becomes necessary. A burr hole itself can be the medical procedure that treats a brain condition such as subdural hematoma, brain tumor, epidural hematoma, hydrocephalus. In many cases, burr holes are the part of the emergency procedure resulting from the traumatic injuries and are used to relieve the pressure on the brain. They drain the blood from the brain after the traumatic injury. They remove the sharpness and other objects lodged in the skull. So surgeons also use the burr holes as a part of the logistical treatment process. They may be needed to insert a medical device. They remove the tumors. They have the biopsy, a brain tumor. Burr holes are the first step to the larger complicated brain surgery as well. To perform a surgery on your brain, surgeons need to get access to the soft tissue underneath your skull. A burr hole creates an entryway that surgeons can use to carefully guide their instruments into your brain. Here we can look how the burr hole surgery process is done. A neurosurgeon who specializes in the brain will map out where exactly the burr hole or the holes need to go. They'll use the results from the diagnostic imaging test your doctor have collected to assess your condition and decide on your treatment. After your neurosurgeon determines the location of the burr hole, they can begin the procedure. Here are the general steps. You will most likely be under the general anesthesia during the procedure, so you don't feel any pain. If this is the case, you also have a catheter during the procedure and in the heart afterward. Your surgeon will shape and disinfect the area where the burr hole is needed. Once they remove the hair, they will wipe down your skin with a sterile cleaning solution to reduce the risk of infection. Your surgeon will administer an additional level of anesthesia to your scalp via a needle so you won't feel the burr hole being inserted. Your surgeon will make an incision on your scalp to expose the skull. Using the special ring, your surgeon will insert the burr hole into your skull. The hole may be used right away to drain the blood or other fluid causing the pressure on your brain. It may be seen holes at the end of the procedure that you need or left open with the brain ocean attached. Once the burr hole is complete, you will move to the recovery area. You will need to stay in the hospital for a couple of nights to make sure your vital signs are stable and to rule out the possible infection. Burr hole surgery side effects. As with any surgery, burr hole surgery carries a risk of side effects. They include the bleeding more than the normal amount. You used to have the blood clots. Complications from the anesthesia also be taken care. People may have the risk of infection. There are also risks specific to burr hole procedure. Surgeries that involve the brain can have the lasting side effects. Risks include the seizure during the procedure, and people have the brain swelling and the bleeding from the brain. Here we can discuss the brain hole versus craniotomy. Craniotomy is also called the craniotomy. This is the main treatment for the subdural hematoma that happens after the traumatic skull injury. Other conditions like intracranial hypertension sometimes call for this procedure. In general, burr holes are less invasive than the craniotomy. During the craniotomy, a part of the skull is removed through the temporary incision. After your surgeon is done needing access to your brain, the section of the skull is placed back over your back brain and secured with the screws or the metal plates. Burr hole surgery, recovery and outlook. The recovery from the burr hole surgery varies widely. The time it takes to recover has more to do with why you needed the surgery than it does with the procedure itself. Once you wake up from the anesthesia, you may feel a throbbing or the soreness in the area where the burr hole was inserted. You may be able to manage the pain with over-the-counter pain medication. Most of the recovery takes place in the intensive care unit in the hospital. Your doctor may prescribe the antibiotics as a preventive measure against the infection. Your doctor will work closely with you to manage your recovery. Immediately after the surgery, you will be able to resume eating and drinking as you would normally. You will need to be cleared by your doctor before you drive or operate the machinery. You will also need to avoid any activity in which you could receive a blow to the head. The doctor will give you the instructions about how to care for your wound. They will also let you know about any needed follow-up appointments. In some cases, you will need to return to your doctor to have the stitches or to drain removed from the site of burn hole. In recent years, some doctors have started the covering the burn holes with the titanium plates after they are no longer needed. How do I prepare for the burn hole procedure? Burn hole surgery is usually an emergency procedure. That means the most people don't have the time to prepare before having it done. If you're having the burn hole inserted to remove a tumor, insert a medical device or treat the epilepsy. You may have some forewarning that you will need this surgery. You may be asked to shave your head before the procedure or not eat or drink anything after the midnight on the day before the surgery. So here I would like to give a conclusion about the burn hole surgery. This is a serious procedure performed under the supervision of the neurosurgeon. It is usually performed in the emergency cases when the pressure on the brain must be relieved right away. After the burn hole surgery, your recovery timeline depends on the health condition that made you need the surgery. Be sure to follow all the post-operative instructions carefully. Thank you.